Hello, it is me, and I'm in the bathroom because I'm going to change my gauze pads, and I wanted to see if I could capture this in an educational kind of way. Now that I'm able to change my gauze, I will show you how that process goes. First, this binder, which has lovely little clips, like a corset or something, have to come undone, and then don't mind my stomach. I just ate way too many cookies because I feel bad that I don't have groceries. I still don't want to move my shoulder down much. I just have to take this stuff off. So right now, these are the little gauze pads that I have been keeping on my drain sites, which are right here and here. I took one of these medium gauze pads, and what I do is I cut it in half because I don't need that much and I'm stingy. Then what I do with it, you don't need to have Neosporin. You can also use like a triple antibiotic ointment. It doesn't matter as long as it's antibiotic specific ointment. It doesn't matter the brand. I don't use a lot, pretty much just about that much. And then I just take the tip of the tube and I smooth it out. So I haven't done any pictures, but this is my chest. 1 week post-op. Here is what is going on so far on my chest. I think they did a really good job with taking out the excess fat, but not taking out all of the fat, because I'm not fat-free. And I mean, I'm lean, but I'm not fat-free. I think the shape is looking pretty good. And here you can see my natural muscle shape. And right here would be where some extra fat would be sitting. But they took a little more out of that side than they did on this side, which you can see doesn't have an indent here. But that'll come back over time. As long as I eat healthy and exercise regularly, it's gonna just sort of even itself out. I will say the worst part of wearing that binder is how dang itchy it gets, especially here. Especially before you can shower. I can shower now because it's been a week and I'm allowed to take off the pads and everything. Now, since I'm at that point of post-op where I don't need to be like, oh my god. But they still want me wearing this binder with the foam on it. So I'll show you how I put that on. It's a real challenge. This is all that I have for drainage from today. From last night, it's been about 12 hours approximately. So that's looking pretty good. Looking like it's scabbing well, and I'm not gonna actually shower today, but I did yesterday just because I want to let my body scab over and heal, so I'm gonna throw those away. What I do next is get this back on my shoulders because I won't be able to do this next part without doing so. This is real difficult when you can't lift your arms up, by the way. So if you need help, get help. Here I have my sterile pad with the gauze on it. I did wash my hands beforehand. I didn't think I needed to film that. I'm putting it just right where that drainage hose had been, where I'm healing, making sure that the sterile ointment is specifically on there. Taking the other one and sticking it on my other side here. Oop. It doesn't have to be perfect or anything. So then I have to take this ungodly, uncomfortable thing. I hate this part so much. This is what they put up here from Minneapolis Plastic Surgery because it keeps compression and keeps the swelling down and all that. And it's always cutting into my dang armpit. I'm gonna just put this back on because I don't have any other pads to use. Let's put it under here a little less casually and a little more seriously. Pulling on this to make sure that it's tucked in enough. And then going to the other side, making sure my gauze pad is still there. It is. And then moving that in. Sorry if you heard my stomach is gurgling. I ate a lot of garbage today. And then breathing, holding it down as you pull one side forward, and then holding it in place and moving your other arm to make sure that this is tucked in all the way, pulling the fabric and pulling it tight from the back forward. And then you can go to clipping the middle clasp here. So I clip that together there. And then I like to flatten this layer behind the zipper out. And then you can just go on to clipping the rest of these together. And then this last one here, I can't see that. There we go. My zipper broke like day 3 of having this, so 3 days after my actual surgery. So I have to be really careful to make sure that this is all perfectly lined up when I zip it, otherwise it'll come undone at the bottom. Looks like it's lined up, and you zip it to the top. The actual binder itself is like cool, I think, like material wise. We've got like this kind of fabric here. It's mesh, it's really fine, laced together like that. It's really comfortable, pretty breathable, loose and flexible, and this pad is the most uncomfortable thing in the world. But as you can see, it stops here and goes under my armpit and holds that gauze in place here. And then it stops, and it's not on my back. That sums up what I have to do with this binder here today. I have to do this every day because I have to change the gauze every day. Last checkup was Thursday, that was just yesterday. That's when I found out I can do all this in shower. And also my next checkup then will be Tuesday, and I'll be seeing the doctor again, and then I will have more information to share. But for now, that is all there is to it, and I will check in later. Bye.